and good morning. February 25th, 2025. I'm Dr. Duke Magin, CEO and founder of the Duke Spine Institute. We are streaming live spine surgery today. We have about 3 cases to stream. We have 2 more we're not streaming because they're going in another operating room where we don't have the ability to stream. But these 3 cases we're streaming will be very interesting patients, and they have multiple things being treated. So this patient, we're going to start by fixing degenerative disc disease that's painful, symptomatic, causing back pain, causing leg symptoms on the left side. He travels here from Florida. We're going to start our first case as L2-3-3-4-4-5-5-1 on the left and L4-5 on the right, so it's a bilateral L4-5 Duke laser disc repair for back pain and leg symptoms. All right, if you have questions, feel free to ask us. Can I inject? Patient is going to be asleep momentarily, but right now I'm going to give him a little bit of numbing medicine under the skin. We're going to have to make 2 incisions on the left. These incisions are a 1/4 inch each, 7 millimeters, to accommodate the endoscopic tube. And we'll make 1 incision on the right. After this procedure, we're going to move on to the SI joints because he has sacroiliac pain on both sides, and he has piriformis muscle pain on the left side. Alrighty, if you have questions, feel free to ask us, but this highlights the fact that there are many different causes of back pain. Every patient is different, but there are the most common causes, such as the discs. Like this patient, his primary cause is the disc. Henry, let's share with the audience 30 different causes of back pain. I'm Dr. R. Duke Magin with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. All right, welcome back. You can see from our video that there are many causes of back pain. And the first thing we have to do if we're going to cure back pain is we have to understand where each patient's cause is. And even though the patients all have the same categories of causes, each patient is different. And each patient, you have to figure out what's causing their pain. In this patient's case, the pain is coming from multiple things, not just the discs. It's also coming from the SI joints and the piriformis. So that's why we're going to be fixing all of those things today. To fix the discs, we first have to get into the discs, and specifically we're going into the place where the disc hurts. It's called the annular tear. That's where the back pain comes from. And I'm making my way to the annular tear. Shot at L4-5 right now. You can see the needle advancing. Shot. We've already gotten into the 5-1 disc. I've got 4 discs on the left side to get to. Shot. All right, let's get an AP. If you have questions, I'll be happy to take them.
We have a question coming from Lanu on YouTube.
Hi, Lanu.
Asking a New Jersey senator was sentenced 11 years to prison for accepting money for favoritism. Will this punishment deter corruption in our lousy healthcare system?
That's a great question. We need to charge these insurance companies as criminals, because they are criminals. They're stealing people's money and promising them coverage for insurance and then not paying. 860 million denials a year for health insurance in the United States. 860 million in an article just released by the Wall Street Journal. That's a lot of not paying for people's medical care happening by these insurance companies who are profiting every time they deny treatment. So deny treatment, make more profit. That's how it works. They should be charged as criminals. They're no different than criminals. They're modern day criminals, you know. To me, at least that's what I believe they are. AP. Anytime you take money from somebody and promise them benefits like health insurance or coverage for procedures, and then you don't do it, you're lying. It's dishonest. And I certainly hope that the Trump administration basically fixes this problem, because it's not something I can fix myself, not something you can fix. All right, we are We need people to fix it. We need a lot of people to get active, politically active, to fix it. But the other thing that can happen is the government can fix it if they're motivated to fix it. They haven't been all these years. They've allowed the insurance companies to basically rob Americans blind. But maybe things will be different now. All right. We are made one incision on the left, 7 millimeters, and I'm trying to fix as many discs as I can. I probably won't be able to get to L2-3 on the left, just because that's a far stretch. But I think I can get to, the 3-4 shot, which is what I'm aiming for right now. A lot of people ask me, Dr. Duke, when you go into the disc like that, aren't you damaging the disc? The answer is no, because we're entering the damaged part of the disc that's already damaged. Sean, let's get an AP. In other words, we're coming from a hole on the side of the spine that's already there, slipping in under the exiting nerve, and we're literally, thank you, we're literally entering the disc right where the tear in the disc is. So I'm a little bit too lateral. I'm not happy with that. I need to get a little bit more medial. Shot. Medial means closer to the midline for those of you who don't know. Shot. And shot. Let's hope that's it. AP. So I repositioned the needle. I aimed a little bit more medially. I was a little too far lateral. Let's hope that we're closer. Let's see. Yeah, that's perfect. So look at the needle tip. Show them the needle tip. It's right at the mid-pedicular line on the left at 3-4. Right there, you guys see the arrow?
Yes, we do.
So that's right where the disc begins. That's perfect positioning. So if I had kept going earlier, we would be off, and we could potentially hurt the patient. Shot. But by adjusting our positioning now, we're in the right spot. Shot. All right, so we're in there. We got one more needle to place at 2-3. I really don't know if I can get to it from here, but I'll try. There's no harm in trying. I might actually be able to. The worst case scenario, I have to make another incision. Shot. Yeah, looks like we might actually be able to do this. All 4 discs through one incision. It's always better when you make fewer incisions, but at the same time, I don't want to compromise the result of the surgery. Jordan, shot, AP. We're going to check the front back. You can see the needles are in perfect position. They're all entering these damaged, painful discs right through the tear in the back of the disc. All right, so we're pretty far off. I think I'm going to just go into a different insertion point up here. Shot. Yeah, I think this is going to be better. Shot. Shot. Shot, by the way, means take a picture, an x-ray picture. Shot. That is the terminology we use. Dr. Patel always says picture, AP. Picture, picture, picture. I say shot. I was brought up at my training program. Shot was what we used in the operating room. Dr. Patel was brought up to say picture. All right, lateral. Lateral is the view that I want. That's lateral is from side to side. AP is front to back. You use 2 different views to guide yourself as you're placing a needle. It's called navigation. Shot. And I'm navigating into the spine right now. Shot. Shot. AP. Pretty far off there. Hold on. Shot. Yeah, I don't know. Let's get an AP. Let's see where we are. Any questions?
Yes, we have another question coming from Lanu once more on YouTube.
Oh, yeah, we're hitting the transverse process. That's why. Yes, Lanu, I'll be happy to take your question. I'm going to go up a little bit higher then.
Asking, insurance often denied claims causing troubles for you guys. Do they also deny claims for MRIs if it's for Dr. Duke? If yes, the insurance is pretty stingy.
Sure. The insurance companies deny 850 million claims a year. 850 million doctor-ordered tests and treatment. That includes millions and millions of MRIs, millions of CAT scans, millions of X-rays, millions of surgeries on all different kinds of body parts, from gallbladders to brain surgery to sinus surgery to OBGYN surgery. I mean, you name it, they are denying it. They're denying everything. The insurance companies, every time they deny a treatment or test, they make more profit. That's unfortunately the wrong way to incentivize an insurance company, but that's how our system is set up. And the insurance companies are perfectly happy with that. They're perfectly happy, AP, we're going to need them awake. They're perfectly happy that you're not getting what the doctor orders. So the only way that the insurance company can say no is by calling the test or treatment experimental. There is no other way by law. They can't do any other way. So now they're calling everything experimental, even an MRI, CAT scan, X-ray. X-rays are experimental, but they're not calling the test itself experimental. They're saying the indication for the test is experimental, meaning that it's not proven to be necessary. But basically, they're doing it for one reason. We all know the reason. It's so they don't have to pay. And by not paying, their profits go up. And their profits have been going up every single year for the last 40 years. Okay? And most of the profits the insurance companies make, you can't even see them. They're hidden. They're hidden in overseas accounts. And they're basically siphoned out of America and out of this country into overseas accounts that the government can't see. All right, well, I cannot get into the top disc. I'm going to try one more time, just see if I can't wiggle this thing in. I'm right there. I'm going to be able to get in and fix it later, but it's so collapsed right now that I'm struggling to get the needle in. You okay? You all right? Let's get a guide wire. I'm going to try one more thing. I'm going to try a little trick, see if I can't get this to work. Shot. The idea here is to get the guide wire to go in because it's smaller diameter than the needle, and then just slide the needle over the guide wire. I'm not able to do that. There's the disc space is so collapsed, I can't even get the guide wire to pass in. So, all right, but we'll get in later when he's asleep more, and I'll be able to get in because his muscles will be relaxed. They won't be compressing down on the disc space, making it narrower. How long has he had back pain for? I wanted to hear lower back pain. 20 years. 20 plus years. Are you awake?
How you doing, my friend? You okay?
Are you having any pain?
Open your eyes. Good.
Are you having any pain? Lay still, okay? Lay still. Can you hear me? All right, lay still. Don't move your body. We're going to wake you up for just a minute to get some help from you, and then we're going to put you back to sleep, okay? Sound good? Lower back pain, 20 years. Are you having any pain?
Are you having any pain right now, my friend? No.
All right, good. No pain. How bad is that on a scale of 1 to 10? How high does that go? 10. Is that where you get your back pain? Is that where you typically get back pain? Yeah? All right, 10 out of 10. Just lay still. You're doing great. So L2-S1 is 10 out of 10 pain. That's the bottom disc. You could see it on the x-ray. So that just tested the disc, and he said, yes, that hurts. That's my typical pain. Is it better?
How's your pain now?
Better?
Yes.
All right. How bad is that on a scale of 1 to 10?
Give us a number.
How high does it go?
6.
All right. Is that where you get your pain?
Is that where you get it?
That's the highest, was 6 out of 10? All right, L45 was 6 out of 10. Is it better?
Feeling better?
All right. How bad is that on a scale of 1 to 10? How high? 10? All right, 10 out of 10 at L34. Is that where you get your pain? Is that where you get your pain? Yeah? All right. We get to put you to sleep. When you wake up, you're going to be done with surgery. I just can't get into 2-3 yet. Long story short, we tested 3 discs. They were all causing his typical daily back pain that he's here to get fixed. The worst 2 on the discogram were 3-4 and 5 L2-S1. 4-5 was a 6 out of 10, but I think a lot of the dye basically went to the front of the disc rather than the back, so I think it's a more painful disc than that, but that was his number. L2-3 untested. Okay.
So we got all 10s and a 6.
Yeah, 10s and a 6. All right. All right, we're ready for him to go to sleep. We're going to start with L2-S1. Henry, let's show the audience, why are these damaged discs so painful?
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Hold on. Welcome back. You can see from our video that the discs are very painful when they're injured if they have inflammation going on in the posterior wall where the tear is. Okay, it's called a posterior annular tear. Posterior as opposed to anterior or lateral. Posterior means the back of the disc. When the tear is in the back of the disc, the pain fibers there are very sensitive and are highly localized, meaning they project to parts of the brain where your brain can say, oh yeah, I know where that pain's coming from. It's coming from my back. Now there's 2 types of pain fibers in the body. There's those that are localized, somatotopically arranged, and those that are non-somatotopically arranged. Somatotopic organization means it goes to a part of your brain where your brain perceives the exact location of the stimulus, in this case being pain. And the alternative type of pain fiber is visceral, and they're called visceral afferents versus somatic afferents. And visceral afferent fibers basically project to subcortical areas or areas below the cortex. They don't project to the primary somatosensory cortex, which is in the parietal lobe. Okay, Brodmann area 312. Brodmann area 312 of the parietal lobe is the primary somatosensory gyrus. It is the gyrus just behind the frontal lobe, the first gyrus in the parietal lobe. What is that? Anyway, long story short, all the sensory projections to the primary somatosensory cortex are somatotopically organized according to where they come from in the body. Therefore, all signals there are highly localized and very painful to the mind. That's why the posterior annulus it projects to that area of the brain, and that's why people perceive so much pain. Now, if you have something like your intestine, for example, has pain, then the same pain signals, they go to a different part of your brain, usually in the brainstem. They don't make it their way up to the primary somatosensory cortex, so they can't be somatotopically organized. In other words, the pain signals get to your brain, but they go to a lower part of the brain that is not localized. There's no localized pain signal. So you can't perceive exactly where pain comes from. Your belly may feel upset, but you can't feel a sharp pain. To get a sharp pain, it has to be going to your primary somatosensory cortex. All right, Henry, we've explained how injured discs cause pain. Now let's show the audience how we fix these disc injuries at Duke Laser Disc Repair.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We are in the L2-S1 disc working, delivering laser energy to the tear, doing what's called a debridement. People ask, is this debridement done with heat? No, there's no heat at all being produced. It's done by transferring energy from a laser fiber to tissues. When the tissues receive the energy, they cannot hold that much energy and they basically explode. All their covalent bonds break and the tissue fragments. That is how the laser works. I don't know, Luis, there's something wrong with this scope or something. I don't know. The image is just not as crisp as I would like it to be. I don't know if you got water between the camera and the scope or what. See, there's something there. Are you guys testing these scopes before you put them on the field?
I actually,
You need to be looking and testing. Okay? If there's an artifact, then it's either going to be the scope or something in between the scope. See the artifact there?
I see it.
Yeah, that's the problem with the fucking scope.
Nikki, you can start when the...
You guys need to be looking at these damn. Too frequent, too much. We're seeing it too often.
Let me know when you're ready. Yeah.
All right, Henry, we've shown the audience how discs cause
Yes.
pain, but also how we fix it.
Of course, yes. And we do have a question coming from Lanu once
Sure.
more on YouTube, asking a question for Dr. Patel. I know
Dr. Patel's not here.
they said I know he can't be on the mic, but is Dr. Patel from
All right.
India?
So Dr. Patel is originally from India, yes. All right, look, Luis, I need
Yes, sir.
to hear from you today what you're going to do different, because I can't have this kind of repairs I can't afford to do these kind of repairs all the time. All right? We don't have a money tree growing in the back. Who's washing these scopes?
Well, right now it's Nikki. Yeah. But I can do myself.
I don't know what to tell you. I mean,
I need more later, please.
huh? I just want you to figure out how to solve this problem. I don't want to have to solve it.
Yeah, yeah.
Nikki, I hope you're not mishandling these scopes. These are very delicate. You know that? But you understand, I've been doing this 20 years. I've never had this many scopes with this many damaged lenses. You're not understanding me. I've been doing these surgery for 20 years. I never had this many damaged scopes. It's you don't want water between that. If that's a wet napkin, it's not gonna work.
It's on. Ready?
Damn it. Get the suction tube out from the pedal. Fucking irritating.
I'm gonna take care of myself, sir.
No, I have a feeling I know what's happening. I'm not gonna let it keep happening. All right. Let's see.
Power is better.
Hmm?
The power is better on the laser.
I don't know if it's really better. It's hard to tell. You can turn it back down and see.
Well, not right now. He's using it.
We have another question
Sure,
coming from Jacobo45 on YouTube,
sure.
asking Dr. Duke, what would it take to compel the insurance companies to admit the efficiency of these DLDRs?
Lawsuits. That's the only way. Lawsuits. They have no interest in covering a procedure that people want. You people don't seem to understand that. The insurance companies want to cover procedures you don't want. There's two types of procedures, elective and emergency. Emergency is life-saving. You come in with a blood clot in your brain, you're going to die. The insurance company, and they're actually not covering those either. They're trying to get away from covering emergency surgery. But they typically will cover life-saving surgeries because they don't want people dying and then blaming them. On the other hand, elective surgery for things like back pain, they don't mind denying it. because nobody dies of back pain, but they do. But nobody dies directly of back pain. They commit suicide, so they die indirectly, or they have no life because they can't work, they can't do anything. So the reality is that, you know, if an insurance company doesn't cover a child's surgery for brain tumor, the child dies, it's all over the news, and the insurance companies are criminals. So they're not stupid. They're going to cover the surgeries that will make them look bad if they don't. And the way that they don't cover surgeries that work is they try to villainize the surgeons or the surgery and make them look like bad people for doing the surgeries on you, so that the public sentiment is against the surgeon, against the procedure, and they don't have to deny the surgery because people deny it because they ran some articles in New York Times or Washington Journal or whatever it is. They manipulate the media so that the public has a feeling about a medical treatment so that it benefits the insurance companies. That's what they do. They did that with drugs. They did that with opioids, making opioids and doctors prescribing opioids and pharmacies giving opioids out when doctors' prescriptions, making them look like criminals, and then suing them, having the government go after and sue them and pay billions of dollars in restitution. That's how they work. The insurance companies don't want to pay for your medical care. So if there's a really good procedure like this, they just ignore it as long as they can until the noise gets too loud. The noise being litigation, public sentiment, public unrest, civil unrest. Everybody's complaining, writing their senators. That's when they have to act and do something. Until then, they just ignore it. Yeah, they're just not getting good destruction of the tissue for some reason. I don't know why. Anyway, it's taking way too long to do one disc. Unfortunately, it requires people like Luigi to get up and make a statement to the world so that it draws the world's attention to the problem. Because otherwise, people just ignore it. I don't condone what he did, but I have to admit it's been quite effective at drawing public attention to denials by insurance companies. You guys have to fix it. I'm not fixing it for you. I can't. The insurance companies don't just ignore doctors like me. They don't listen. They don't care. They don't want pioneers in medicine creating better, safer treatments that more people will want, that they'll have to pay for. That's the last thing in the world the insurance companies want. Come on, Jordan. Move with a purpose. You put pressure here. I'll take care of that. Okay? Shot. All right, we're going to be going to the left L4-5 next. We've just finished L5-S1. Shot. All right, very good. So Henry, we've already played the video on 30 different causes of back pain.
Yes, correct.
As well as how the discs themselves cause pain.
Correct.
And how we fix it. Go ahead.
Yes. In the meantime, why don't we show the audience of how it is facets cause back pain, the second most common cause of back pain, and how it is that
Sure.
we cure it.
Sounds good. I will do that. Give me something to.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right. You can see how facets cause pain. This patient doesn't have facet pain that we know of. He may develop it later. We don't know if he's going to or not. About 25% of these patients will have facet pain later on that comes up and need it treated. Did you show the treatment for facet pain?
Yes, we did, of course.
All right, good.
And we have a question and a comment.
Sure.
Question coming from Lanu once more on YouTube asking, this patient is struggling. How long did he had a herniated disc?
I don't know how long he's had a herniated disc, but he's had back pain for over 20 years. And we think it's the discs that are causing his pain. So we don't know how long he's had a herniated disc. These are old disc injuries. If you look at these discs, they've been injured for many years, over 10, 15, 20 years. All this is scar tissue here. This is all evidence of chronic inflammation. The white stuff that I'm removing. Scar tissue, lots of it, bone spurs, indicating disc problems for a long time. This disease will rob people of their quality of life. When your back hurts all the time, you can't do anything. You can't work properly, you can't enjoy life properly, so we recommend getting these things fixed right away rather than waiting 20 years. On the other hand, some people just find out about our treatments and 20 years have already gone by and there's nothing they can do about it, and they just come as soon as they can. You know, these treatments are expensive. They're not everybody can afford to do them. The insurance companies try to get out of paying for them, and they're successful most of the time. So most people put these types of surgeries off. They live with the pain. They let the pain control their life. Unfortunately, their quality of life deteriorates. It sinks down, it becomes bad. They may treat their pain with alcohol or drugs, which of course are not good for you. Neither of them. Alcohol is toxic, it's a poison. Drugs are very bad for you as well, especially narcotics, which are the most common painkillers. So their quality of life is just garbage. All right, I'm working laterally in the annular tear. This is all scar tissue, inflammatory tissue, herniation stuck in here.
We have a comment and we have a good amount of questions.
Sure.
Comment coming from Brian on YouTube saying he is right about that. They are only just now starting to cover disc replacement because people are starting to sue.
Well, you're right, Brian. I mean, look, disc replacement with artificial discs, they came out FDA approved in early 2000s, around 2001. Okay, I was one of the first surgeons putting them in America. They were out in Europe for 30 years before America. But the early discs, artificial discs, were really bad. They were like balls, metal balls they just stuck in there. So they had all kinds of problems. But by the time we got the artificial discs FDA approved, all the insurance companies called them experimental and didn't want to pay. Okay? So then there were some lawsuits that were filed by patients who paid for it, the artificial disc surgery, and billed the insurance. The insurance denied it. The patients sued them and they won. And after enough lawsuits, the insurance companies, after losing enough lawsuits, the insurance companies started to cover the artificial discs. First, they covered 1-level lumbar, then 2-level lumbar, cervical 1-level, cervical 2-level. Now they're covering multi-level cervical and lumbar. But the question is why? Was it the lawsuits? We don't know. Probably the lawsuits, but the reality is the companies that own these artificial discs and sell them, they make billions of dollars in profits every year. And with those billions of dollars, they buy off senators and congressmen. They buy off lawmakers who write laws. And they buy off the right people. Okay, we don't have the ability to buy off people at Duke Spine. I wouldn't buy off people anyway, even if I could. I'm against it. I think that there's a right way to do things, a proper way, and I don't believe in buying off lawmakers, politicians. I don't have a problem hiring a lobbyist, but I have a real problem buying people off because that's illegal and I don't believe in doing that. I believe in legal ways of fixing problems. Okay? That's what I believe in. So, the only legal way that I can think of to fix the problem of lack of coverage by insurance is to sue them. That's it. But I can't sue them. The patients have to sue them. We're done here. So if patients aren't willing to sue their insurance companies, then nothing's going to change. Nope, nothing will change. The insurance companies are going to keep doing bad things. The insurance companies are like criminals. They will keep robbing and stealing and doing criminal activity as long as you let them. You, the American people. The American justice system. Only when you guys decide to do something about it will it end. But it's going to take a lot more than one neurosurgeon. All right, we'll keep going on these questions.
Not a problem. Next question coming from Charlie on YouTube. Asking, you mentioned before that surgeons today typically push pain issues off to pain management. Does this happen because insurance companies won't approve surgery for pain, and how to change that philosophy?
Yeah, it's a great question, a great comment, by the way. So, in the world, and the United States typically leads the world and how it manages disease. Hold this. Typically, okay, the general consensus is that pain, back pain and neck pain are not fixable, period. So you have a non-fixable condition. And so surgeons believe it's not fixable. Therefore, there's no surgery to do to fix it. That's what they're taught. So we're all taught to send our patients with back and neck pain to pain management. Sean? Pain management doctors do things like shots, medication, therapy, etc., to manage the patient's pain. But they can't cure the pain, they only manage it. So pain management doctors use pills, shots, and now surgeries themselves because there's such a big business in pain management that the companies that manufacture treatments, devices like spinal cord stimulators, they see billions of people worldwide with back pain. They see that as a market. Like, we can go make money on these people. So, and they love it because these people never get out of pain. So they take one treatment, they make $10,000, they do another one, 10,000, another one, 10,000, another one, 10. You can make millions of dollars off one patient doing treatments that never fix the patient's pain, but just enrich the doctors and the companies manufacturing the devices that they're using to treat their pain. We don't do the same thing. We want to cure the patient's pain, and we have the ability to cure the pain, but it requires our treatments, which nobody else does. So we're the only ones curing back pain and neck pain because we're doing the treatments that are curative. Whereas these other doctors don't want to cure back pain because they're going to lose business. You see, we draw patients from around the world. We're not losing business. If we fix somebody's back pain, we just get another patient from some other country or some other state. But when these other doctors who draw locally from their local market of patients, when they cure a patient with back pain, they've lost that patient forever. So they're not motivated to cure anybody. They want to keep you people in pain. But the patients don't want to live in pain. They want to be cured. So the patients want something the doctors aren't willing to give them. They want something that the companies that make the treatments for back pain, like pills, shots, stimulators, those companies aren't willing to give the patient a cure either. They want patients to be in pain so they can give them another treatment a year later. Now, the insurance companies are paying for all these treatments because they don't know any better. Number one, they don't realize that we have a curative treatment that they should be paying for. But also because the insurance companies want patients to know and believe that there is no cure for pain, so that all the treatments they can get are just temporary, so people refuse them. You know, there are, let's say, 1 billion treatments recommended, not even 1 billion, it's more than 1 billion. Let's say 10 billion back pain treatments recommended a year, and only 1 billion are done. Because 9 billion of the patients say, we know that shot's not going to do anything, and it has side effects, so I don't want the shot. Or I'm not going to take those pills because they're not going to fix my pain, so they refuse the pills. Point is, patients, everybody knows the treatments don't work. That's why patients refuse the treatments. Insurance companies are happy that patients are refusing treatments because then they don't have to deny that treatment. They just have to let the patient deny it. And then they're not looking like the bad guy anymore. All right? When the insurance company denies, they look like the bad guy. When the insurance company doesn't deny, but the patient denies, then they look like a saint. Right? And that's what they want. They want to look like a saint even though they're not a saint. All right, keep the questions coming.
Of course, the next question is coming from Karsten on YouTube.
Yes, Karsten, welcome.
Asking, I am working on a concept to create the facet joints to be primary weight-bearing part of the spine versus the discs. Do you think this is logical as animals are using these as primary weight and power distributioners? This way the disc will be less subject to tweaks and misalignments. Discs are shock absorbers, and shock absorbers are very bad to distribute power.
Well, it's a great question. Yep. All right, he has more. Go ahead.
A little bit more. Is saying, therefore, the approach here from regular facet joints as primary weight and power distributors. Power and weight are essentially the same thing.
Yeah. So first of all, I'm not going to lie to you, but the disc bears 85% of the weight, and the facets bear 15% of the weight. you're never going to make the disc or the facets bear more than 50% of the weight. It's not possible. Okay, biomechanically not possible. The reason is the shape of the spine, the way it curves. The curvature of the spine is what determines the distribution of weight. You would have to reverse the curvature of the spine, or actually exaggerate the curvature of the spine in the lower back and neck, in order to make the facets the primary supportive weight. Come on, Luis, stop getting the goddamn thread on there. You're just adding more time. So if you want the facets to take more weight, you'd have to hyper extend the spine. Nobody can live like that. It's impossible. Yeah. And by the way, the facets get injured too. And so you would just be switching one pain source for another. All right, there's a big piece of herniation here I'm working on, and it's coming up in little pieces. It's sitting right down here. You guys see it?
Yes, we do.
Now, when I put the tube in, I push this into the disc. There we go. That's a pretty good piece right there. I'm not going to stop and look at it because we have a lot to do, and in the interest of finishing this surgery, I want to keep moving. Any other questions?
Yes, another question coming from Karsten once more on YouTube, just a follow-up saying that that is the reason for focus on using facet joints for main weight distributor, but are they strong enough, or have we humans made these weak due to no use, if not heavily involved in deadlifting, etc.?
Well, I like the fact you're thinking, this way, Carson. Honestly, I do. But the spine is created in such a way that distributes weight the way it's supposed to. The vertebral bodies are the primary supporters of weight, and the discs are between the vertebral bodies. They're just a joint that allows movement. So I don't know that you're going to be able to fix anything by switching to the facets as being more weight distribution, because facets get injured every time the disc gets injured. The same injuries that cause disc injury cause facet injury, and the facets become painful and they have localized pain. Now, that said, if you could create a human where the facets bore more weight, facets are injured more often, instead of the disc being the primary cause of pain 85% of the time, the facet is the primary cause of pain 85%. Facets are easier to get rid of pain than disc. Discs require this elaborate surgery with the endoscope, the laser. Facets can be fixed quickly with denervation of the joint. Just go in there and cut the pain nerve. That's what we do with our Duke plasma rhizotomy. So facet pain is easier to treat than disc pain. It's faster, safer. Disc pain is much harder to get to and fix, like transforaminal endoscopic surgery. Very difficult to do. Great question. Great thinking. I like how you're thinking outside the box.
And at this moment, no current questions.
All right. Yeah. Dr. Berndes likes your name, by the way. Your same name as his son. All right. We are done with this disc as well. One more disc to go, I think, or two more discs to go. Sorry. We got to do the right L4-5. We have to do the L2-3.
We have a comment coming from Charlie once more on YouTube, saying the pain issue is frustrating because it's all about the quality of life. When you present well in evaluation, it doesn't show the daily pain. Good strength and pain seem to exist together.
Yeah, so it's a great comment you're making, but the reality is when you present and there's not much pain, it doesn't make an impression. It doesn't matter what impression you make. The surgeons and doctors can't fix your pain. So you need somebody like me to diagnose the source of pain first. And I'm only one person. And I'm literally the best in the world at diagnosing the source of pain for back pain. That's because I know all the sources and I fix them all. and I can see what happens when you fix them, so I can follow the pain, and when you get rid of it, I can see it got rid of with my treatments. So unfortunately, other doctors don't have that ability to do that. And as a result, they don't know where the pain comes from. As a result, they can't diagnose your pain. As a result, they can't fix your pain. If you can't diagnose the source of pain, you cannot fix it. It's not possible. Curing a problem requires diagnosing the source of the problem. That's true for everything in life. Even if you have a problem with your car won't start. You need someone to diagnose why it won't start. Is it the battery? Is it the alternator? Is it the starter? What is the reason your car won't start? Because whatever that reason is, it has to be fixed. If you go and fix the battery when the battery is not broken and the problem is your starter, you change the battery, you're not going to be any better off. Your car won't start. So in reality, to fix problems, you have to diagnose them first. What's the source of the problem? And no doctor in the world can diagnose back pain except us. I'm making a bold statement, but it's absolutely true. There's a reason for that. The first and most important reason, we're going to do this guy. Huh? We're going to do this guy. The first and most important reason doctors don't diagnose back pain is they believe it doesn't have a specific cause. You understand? Doctors believe back pain is non-specific. Look it up, Google it, non-specific. Non-specific means no specific cause. That is what they're all taught, but some of us are realizing that that's not true, that back pain does have specific causes. But most doctors are taught no specific cause for back pain. That's why they come up with diagnoses like fibromyalgia, non-specific, soft tissue pain, no cure, no treatment, just take pills the rest of your life. That's because the companies that make those pills want you to take pills because they make money when they sell you the pills. They don't want you fixed. They don't want you to know there's a cure. There's a cause and a cure. Okay? So 99% of doctors believe there's no cause to your back pain. They'll say it's your muscles or, they won't even know what it is. They won't even know where to begin. Now, a few doctors are realizing there are causes to back pain that are specific, and they're willing to try to fix them. And one of the ways to cure back pain is to fuse the spine, okay? Now, fusion is way overkill. What does that mean? It means you don't need it because fusion fixes disc pain and facet pain both. It takes away disc pain because it takes away movement of the disc. It takes away facet pain because it takes away movement of the facet. When you take away movement of a painful joint, you take away the pain from that painful joint. Okay? That's why they used to fuse knees. They used to fuse hips many years ago before they came up with artificial knees and hips. The reality of the situation is that knees and hips don't need to be fused to get rid of the knee and hip pain. You can actually cut the arthritic joint out, put a metal joint in. And that's why artificial discs have come about, because they want to take out the painful disc and replace it with a non-painful disc, which is made out of metal. Metal doesn't hurt. When you have a metal disc in your back, you don't have pain fibers. It can't possibly hurt. Does that make sense? Hold on. Take that. All right, we are entering L2-3. You can see the separation of the bones at the disc. You see that white thing is getting bigger. It's spreading open. That means the disc is opening. And this is exactly what I expected because this is a collapsed disc. And now we're getting into it. But it required the patient to be asleep, his muscles in his back to be relaxed because he's asleep. He's not feeling the pain. He can't tighten up. So I can now get in. It's still a chore to get in. It's very difficult. He's probably going to collapse and bend this tube and break my tube, but that's okay. We'll buy another tube. All right, questions?
Yes, we have a lot of questions, but I just want a comment following up from Charlie's question once more on YouTube saying, yes, as a former electronics technician who did loads of troubleshooting, I can completely appreciate your comment.
Yeah. The human body is the same. It just has to be figured out. You got to come up with a diagnosis. That's the problem. Shot? All right, it's not moving. So when you do that, when you come up with a diagnosis, let's try now. You can then know the source of the problem, then you can come up with a solution. Not everything has solution, right? If you have death, somebody dies, okay, they die of a heart attack, you know the problem, they had a heart attack. They died, but you can't fix it. Shot. Oh, mama. Yep. This is going to be bad. Get the vice grip. We may need it. But first I'm going to bring in the big muscles. Luis's big muscles. You want him to move a little north or? Yeah, that's good right there. All right, Luis, let's see if you can do this. I'll be impressed. So basically, we're going into the most collapsed disc of all, L2-3. We're trying to get in so we can get rid of the pain source here. Here, I'll hold this. You do two hands. Go ahead. And the disc is so collapsed it's pinching the dilator. Keep going, keep going. I'm good. Mine's not coming out yet. Mine's not moving. Keep going. This is troubleshooting. By the way, we don't see a lot of this problem. It looks like we're going to lose a dilator. Because once he puts the vice grip on this thing, it's going to crush it and it'll be useless. But we got to get it out. We don't have much choice. There we go. It worked. Maybe next time we do the vice grip, we put the two guide wires in to try to keep the holes open. Yeah. But otherwise, that's $1,200. Goodbye. Unfortunately, these instruments are very expensive, but our patient comes first, and sometimes we have to sacrifice. Let's hope we can get this done. All right, keep the questions coming.
Of course. Next question is coming from Faisal on Facebook.
Hi, Faisal.
Saying, Doctor, hope you are well.
Thank you.
Just out of topic, what do you do in your spare time?
What do I do in my spare time? I invent. I'm an inventor. I patent things. I need to see the endoscope, guys, up top. Also, I garden. I'm a gardener. I have a beautiful garden at home. I grow orchids. Why? Okay, there we go. Look how collapsed this disc is, guys and gals. Look at all that red stuff. That's all inflammation and bone spurs at the back of the disc. That's where the pain comes from, right there. So there's no herniation to pull out right now. There's just all this inflammatory tissue. And that's what's causing his pain. There's a little bit of herniation left. We're going to get rid of that right now with the laser. All right. You got a new dilator? So I do a lot of gardening. I spend several hours a day in my garden growing orchids. That's what I love to do in my free time. It's very, very relaxing for me, but it also gives me time to think about the problems that we encounter every day in our business and how to solve them. You can learn a lot from plants. You can learn a lot from studying orchids, for example. Orchids are highly evolved plants. Each one of them is different. They come from different parts of the world. Some come from tropical islands like Borneo, or some come from South America, for example, Venezuela, Brazil, Chile. They come from all over the world, essentially. Costa Rica is another island. So these orchids, they're not the same orchids everywhere. They're different. in different locations. As a matter of fact, orchids are found on every single continent except for Antarctica. And they're highly evolved and highly adapted to their environment. What does that mean? It means that if you study their structure, you'll understand the function. For example, some orchids, like these things called Myrmecophilia, they grow very long stems for their flowers. Why would they do that? So that the flower can be seen by a pollinator, like a bee or a wasp or a fly or a moth that's flying by, right? So they elevate their flower way up above the rest of the forest, above all the other flowers, because they have a very long stem. It can be about 4 or 5 feet long, and the flower is at the end of the stem. So very elegant, very beautiful, but basically it's adapted to its environment, where it's obviously comes from a very heavily dense vegetation forest area, and its leaves are long and broad, and the flowers are put up on a pedestal that's 4 or 5 feet long, sometimes even longer than that. So I like studying plants because they can teach us a lot about life and how to adapt to life, how to change and evolve and adjust. Yeah, I like plants a lot. There's a lot more to plants than that, obviously, but that's just a small example. My kids are in college. I love spending time with my 2 children. As a matter of fact, I'll be visiting them this weekend in New Jersey. And my wife, of course, I enjoy time with her. Walking the dogs. We have 5 dogs, and we take care of them and get to play with them every day. Feed them, walk them, care for them, just, huh? Yeah, no, my kids are harder than the dogs. I just got through trimming all the oak trees in my yard, so getting them pruned. Yeah, I enjoy gardening and stuff. But I also love taking care of my patients and getting them out of pain. I don't enjoy writing papers because I feel like it's a waste of time. It doesn't matter how many things you publish in the medical literature today. Doctors don't read it, they don't care. There's too many special interest groups. They don't want your publication. They want you to put metal in people's backs. They don't want laser surgery, because there's no money to be made for these big companies in laser surgery. I've enjoyed working on our movie that's being produced, that hopefully will be finished this week. It's gotten pushed back a little bit on its completion date because of the soundtrack, which is the last part. So sort of the soundtrack and integrating all the sounds of the actors and actresses' voices, plus the sound effects, plus the background sounds, plus the music score. So we're almost done. So I've enjoyed working on the movie. Yeah, I mean, there's a lot of things I enjoy doing outside of work. All right, what other questions do we have?
Next question coming from Lanu, once more on YouTube, asking, we often see fundraising events dedicating to seeking cures for cancer. I believe donations are wasted because insurance and pharmaceuticals don't want the cure. They only care about profit. Is this right?
Yeah, unfortunately, you're right. That okay. So I just heard on the news last night, Fox News, which is what I watch, that the Red Cross raised $500 million for I think it was the hurricane or something damage, and this was overseas. This was in maybe Haiti, $500 million, and they were supposed to build houses with it. They built 6 houses for $500 million. I mean, that's the problem, is these charities are just corrupt, and you donate your money to them hoping that it's gonna go for a good cause, but it doesn't. So I agree with you. I don't believe in donating to those types of charities because they're all corrupt, They take the money and they squander it. That it doesn't go to the people that need it.
Next question is coming from Faisal, once more, on Facebook, asking, I just don't understand how surgeons can't understand that there is a structural cause for back pain, even if the patient is telling them.
That's, Faisal, that's because you watch my broadcast. That's the only reason that you know there's a structural cause. Because I've discovered the structural causes over the last 20 years, and I'm telling you about them. But the problem is all these other doctors believe that back pain is non-specific. Non-specific. That's what they say, non-specific. Meaning there is no specific cause. And they always send the patients to pain management. And pain management used to do pills and shots, but now they're getting into the business of putting implants in, like stimulators. And that's all being driven by industry, who's making billions of dollars profit selling those stupid stimulators that they're recommending to be put into all the patients. Those stimulators literally cost $20,000 for a piece of wire and a battery with a small computer on board. Literally, that thing probably costs no more than $50 to make. And they're selling it for $20,000, $30,000, depending on the model you buy. It's disgusting. And the insurance companies, like our government, Medicare, is paying for those stupid stimulators. They're paying $30,000. And basically, the doctors are getting rich that are putting them in. The surgery centers are getting rich that are putting them in, or hospitals. And the companies selling them are getting rich. And patients are getting these devices put in them, like the barricade device, or getting these procedures like the basovertebral nerve ablation. They don't work to eliminate their pain, and they just cause complications, and they cost a massive amount of money for the system. It is a totally corrupt system. Hold on. Let go. Where is the end of that guide wire? Oh, shit. All right. So that's the problem. Nobody wants pain to be specific except the patients. And the patients are in the dark. Patients want a specific cause because they want it to be fixed. And there is a specific cause. But the rest of the industry is so corrupt and so bent on profits, they don't care to fix people's pain. Sean? Why are we different? Because I was brought up different by my father. I was brought up to do what's best for the patient, and always do your best for the patient in medicine. Therefore, I have. And it turned out that my best has discovered the cause of back pain, neck pain, and the cure. I'm just a different animal. All right. I believe in doing what's right for people to help them, not take advantage of them. Unfortunately, most of medicine just takes advantage of the patients. I believe someday that will be different. I believe that people will find out about our treatments, they'll want them, and enough people complain about it, their insurance will do something different and they'll start to cover it. And people's access to these treatments will increase. Basically, people will be able to get these treatments done, okay? And covered by their insurance, which it should be. People should not have to pay out of pocket for these procedures. These procedures work, and they're very minimally invasive, and people recover very quickly from them. Go back to a normal life. It's far better than any other treatment out there. All right. Go ahead. Henry, what other questions do you have? This is our last disc. So we've done the left L2, 3, 3, 4, 4, 5, 5, 1, and now we're on the right L4, 5. Remember, we already did the left L4, 5, so there's going to be some blood here, which you're seeing in the disc space from me doing the other side.
Question coming from Karsten once more on YouTube, following
Yes.
up on their facet joint question, asking, I meant because we ignore the evolutionary use of facet joints and discs, then these become weakly developed. Even the bones in the facet become thin and fragile. I assume this is correct?
No, it's not correct. What happens to facet joints as we age is they react. Go look up something called Wolff's Law. Wolff, W-O-L-F, Wolff's Law. It's an orthopedic surgeon or orthopedic doctor who discovered that bones, that the light is reflecting off there and it's really affecting my ability to see. Thank you. Wolff's Law says that bones get thicker and react to stress. Your facet joints over time as you get older in age, they are stressed throughout your lifetime, so they do become thicker, not thinner. I don't know where you heard they become thinner. That's not true, though. They become thicker. And the more stressed they are because of injury, the thicker they become. As a matter of fact, everybody that gets older that has injury to their disc or facet, the facet's enlarged. It's called facet hypertrophy. And sometimes we see those facet joints will be literally 3, 4, or even 5 times the size of a normal facet that the patient had normal when they were young, before the injuries. So bone hypertrophies or gets enlarged with stress. Wolff's Law.
Next question coming from Faisal once more on Facebook, asking, Doctor, is it okay for your spine to not have any discs there in the context of a severely collapsed disc?
Yes. Faisal, you are correct. We don't need discs. Okay, the disc can be completely collapsed and patients are asymptomatic, no symptoms. What is the disc? It's truly just a way of taking an embryological tissue called the notochord and putting it away in a place where it's not visible to your inflammatory system. That's the center of the disc, okay? The notochord, which is very important during embryological development of a human fetus, it actually is responsible for germ layers like endoderm, mesoderm, ectoderm developing into skin, integumentary system, respiratory system, muscles, bones, ligaments, everything inside your body. The notochord directs that. And then when it's done, it becomes the nucleus pulposus within the center of your disc. And the annulus fibrosus wraps around it and hides it away. Okay? That's what happens. But when you get a tear in the annulus and the nucleus pulposus comes out, now it's exposed to your circulatory system and it creates an inflammatory response, and that's exactly what causes all the pain, is inflammation. Right there. You guys see that? Inflammation right there?
Yes, we do.
That is the inflammation I'm talking about. This red stuff. As soon as I zap this away, the pain will be gone. That's not normal. It shouldn't be there. Just about done with the last disc. We're done, almost done with the Duke laser disc repair. Next, we're going to move on to the sacroiliac joints. We're going to do a bilateral Duke plasma rhizotomy. So we're going to end this stream in about a minute, and then we're going to go on to the sacroiliac joints as a second stream. So just rejoin, and then you can watch us do bilateral SI joint Duke plasma rhizotomy. Basically what we're doing is, you can't fix an arthritic sacroiliac joint. What you can do is you can kill the pain nerves to the joint, and that takes the pain away. That way you keep your normal joint, you don't have to fuse it, and the pain goes away permanently. Any other questions?
Yes. This next 2 questions are coming from Karsten, once more on YouTube.
Yep.
First asking, are the ligament around the facet joints often lengthened and stretched, which after an injury allow for more movement of the vertebrae and discs, etc., which then again makes squeeze of the disc likely?
Yeah, great question. So Carson, what happens is during an injury, the capsule and the ligaments around the facet are torn. They tear. Once they're torn, the joint becomes unstable, it wobbles around, and it causes pain. And it gets bigger, remember Wolff's Law? And it tries to basically hypertrophy and enlarge in order to stop the abnormal movement It's a response of the body to stabilize the joint and stabilize the abnormal movement. But what happens is the joint gets bigger and ends up pinching nerves at times. But of course it causes inflammation and causes pain. All right.
Just about 2 more questions. Next from Karsten once more on YouTube, asking how to contact you, and are you interested in hearing more about my developed approach to re-evolve humans to use facet versus discs for uprightness?
Yeah, Carson, I'm very limited in my time, and I'm really a clinician, not a researcher. I spend my time caring for patients, getting them better. So I appreciate your interest in working with me. I don't know that I could be much help at this point, only because I'm very involved in too many other activities and I just don't have the time. But good luck. I think it's an interesting concept you're talking about.
Of course. And then lastly from Charlie once more on YouTube, asking, did you choose the Duke Institute location for the weather, proximity to NASA to see the rockets, grew up there, or best for your business model?
I chose this location because of Luis. Luis lives here, and that's why I chose it. No, I'm kidding. But Luis is a big part of it. I chose this location because there was a hospital looking for a neurosurgeon about 21 years ago. 2 hospitals, as a matter of fact. One of them is closing. It's going out of business. But they hired me to be a neurosurgeon for the community, and I set up my practice here. And honestly, I was just expecting it to be a regular neurosurgery practice like every other neurosurgeon, doing some spine, some brain tumors. But what happened was I was really good at curing people's back and neck pain, and my reputation got out and people came from all over the place. And then I happened to be able to go overseas and learn how to do endoscopic spine surgery. My wife recommended I do it. I thought it was kind of a joke at the time because I had had the best training and I didn't think there was anything I hadn't seen that was worthwhile because I went to the best training program. So I was a bit arrogant at the time, but I was wrong and she was right. And I listened to my wife and went and learned how to do endoscopic surgery. So here I am. Just my practice has evolved over the years to fixing people's backs and necks because we're good at it. All right. Oh, this is a nice big piece of herniation right here that we took out. We took out a lot of little pieces, but there's a good size one. You see that?
Yes, we do.
All right, we're going to end the stream. We'll be back in a few minutes to do the bilateral sacroiliac joints. But we did all those discs, both sides, with just 3 little 1/4 inch incisions. Hope you enjoyed it.